We're ready.
Okay. Hi, everybody. This is Dr. Becky. Welcome to my Tuesday night call. This is very exciting. I'm still getting to meet a lot of you over the phone. Such great energy in this company. And tonight, I'm going to share with you about the cyclodextrin technology, what we have in our hands. We're going to look at various triads with this technology and our ingredients. So by way of background, I'm a gastrointestinal specialist, now retired. I retired in 2005. And I retired because I wanted to pursue nutrition, holistic approaches to help people get their balance and get their quality of life back. And before we get into all the nitty gritty on things, I'm going to try to keep it as basic as possible. And then you can use this video as a tool as you share this technology. Just again, by way of background, being a GI physician, you would come and see me if you had issues with your esophagus, your stomach, small intestine, large intestine, the rectal anal area, pancreatic issues, gallbladder, liver. And I had a booming practice because there was a lot of disease and illness of the GI tract. And I saw a lot of inflammatory conditions. I saw a lot of irritable bowel, and it kept me pretty darn busy. So when I did retire, the world became my waiting room because now I could help a lot more people by introducing them into how to balance their body, create homeostasis with really great products that deliver results. Now I'm going to share a story with you because I think that this will absolutely help you understand what was kind of a turning point in medicine for me in GI to then start to really look at nutritional approaches to help people. And I have this one patient that will always be so near and dear to my heart. Her name's Liz. Liz was in her 40s. And when I was in traditional practice, I diagnosed her with inflammatory bowel disease. So she had features of both Crohn's disease and ulcerative colitis, and she had a very difficult inflammatory condition of her colon, mainly her colon, that was really hard to treat. And this was early on in my career. So I had just come out of, my GI fellowship, and I knew all about the drug. I talked about this before. When I was in med school, there was a year of pharmacy, a year of pharmacology, and 3 days of nutrition training. So when I went into medicine and into my subspecialty, I was just taught that this is what you do for inflammatory bowel disease. You start with this anti-inflammatory, and then you go to this steroid, and then you go to this stronger anti-inflammatory, and then you'd go to this, and maybe antibiotics. And so it was this layered approach of pharmaceuticals. And I remember Liz coming in, and God, she was really looking bad. She was sick. And I said, "What's going on with you?" And she's like, "Well, I'm stressed to the max." She had some issues at home. Her rectal bleeding had started up, a distension started up. Her abdomen was very tender when I examined her, and I was real concerned about just the way she looked. She wasn't eating right. She wasn't staying hydrated. She was just a big disaster. So I said, we've got to take a look in there, got to do a colonoscopy. And so she did the prep and get all cleaned out. She comes to the GI lab. And honest to goodness, I put the colonoscope in. She's completely sedated. She's on propofol. She's sound asleep. Vital signs are stable. But when I put the colonoscope in, her colon was the color of purple black, and it smelled. And I have never seen anything like this. What was basically happening to her, she had such bad inflammation and her body was just not able to handle it. And she was manipulating her medications at home without my knowledge. And it looked like gangrene of the colon. And I said to one of the GI nurses that I'd worked with for years, I said, "Can you call upstairs to the surgical unit? Because I need a surgeon to come and look at this because I've never seen anything like this. And I think she's going to need to have her colon taken out." So I didn't go very far into the colon because I didn't want to perforate, which means put a hole in the bowel because it just looked so fragile. And one of my favorite surgeons was working that day, Dr. Terry, brilliant man, brilliant surgeon, especially in the area of the intestines. So he was not scrubbed in for anything. He just came down and he looked at what I was seeing and he's like, "Oh my God," he goes, "This is the worst case of early gangrene I've ever seen in the intestinal tract." And yeah, he goes, "You need to let her wake up so she's lucid to make the decision of getting her admitted today, and she'll either need all of her colon removed, called a colectomy with an ileostomy bag, or partial removal based on what he would see in surgery." So I let her wake up, and she had family there, and she was lucid. And I said, "Liz," and I explained everything. I said, this is bad. I mean, the colon's so unhealthy, you're going to have surgery." And she just looked at me and she goes, "No." She says, "No, I don't own this. And I have not been taking care of myself, and that's going to switch. Now, the reason I'm telling you the story, everyone, is that true health and balance and quality of life is a multifactorial approach. And we have something great. We have a gift that we're giving people. And are we going to change lives? Absolutely. Are we going to just see amazing testimonials and results? Absolutely. Are we a magic bullet? No, nobody is. This is about multifactorial approach to create balance, homeostasis, and quality of life. So Liz checked herself out against medical advice, and I just felt in my heart I would never see her again. And I tried to call her many times, and all of a sudden her phone was disconnected. I couldn't get in touch with family, so I never knew, what happened. And about 6 months went by, and I'm in clinic ready to see patients, and one of my medical assistants comes back, and her name's Nikki, and Nikki says to me, she goes, "Guess who just walked through the door?" And everyone knew the story about Liz. And I said, "Who?" And she goes, "Liz." I said, "What?" She goes, "Yeah, she's alive and she looks amazing." I'm like, "You're kidding me." So I just brought her right back to my office, and I said, "Liz, I thought you passed." I mean, she goes, "Nope." She goes, "I just straightened my act out." She went on a spiritual journey. Again, some people have that, within them, that they use spirituality to create some balance within the body and brain. She also started to eat much better, stay hydrated, got rid of as many toxins as she could. Without my knowledge, I didn't even know she was alive. She stopped all her meds, and then she went on to ionic minerals and organic whey protein and adaptogens and vitamins and antioxidants. And she just gave me this whole list of what she was taking. And I said, "Did you have your surgery? Did you have your colon taken out?" And she said, "No." She goes, "My colon's still there. In fact, do you want to take a look this week?" And I said, "I absolutely do." And so her using all these facets, to create balance and healing within the body, I took a look at her colon, and it was pink, and it was back to normal. So she shifted me and the way I thought, because I was still at that time all about the drug. Now, there's a reason for pharmaceuticals. I'm just not into giving them chronically over long periods of time if we can avoid that. So she really she gave me focus, and she gave me clarity on what I needed to do. And I then started to get into the realm of nutrition, learning holistic approaches, working with my patients on a different level. So that being said, let's dive into what we have here in our hands. Okay, we have a product called Access Clarity. What a phenomenal name, because this product is all about supporting this access between our gut and our brain, and allowing for clarity and allowing for focus and mood stabilization because of the pathophysiology behind the nutrients and our delivery system. Now, we're not nano. We're not in my cell company. We're not a liposomal company. We don't do emulsification. Those are all based on fat solubility and fat delivery systems. We are a water soluble system because cyclodextrin is about the little tiny glucose molecules. These are sugar molecules. They're very tiny, but they envelop our triad of nutrients, the N-acetylcysteine, the thiamine, and of course, the curcumin. And when you place a strip on your tongue, there is rapid passive diffusion, which means it's rapidly getting into your vascular system. Now, there's other products out there that are, on the tongue, and you can swish them around in your mouth, but those are nanotechnologies and liposomal technologies. And there's a study I'm going to go through with you right now that looked at this passive rapid absorption with different nutrients that outdid all of the nano and the other technologies using fat like liposomal. Because when you ingest a nutrient and you're taking it in with glucose, it has the ability to go right in. And we can measure that in the research labs. We can measure with something called spectrometry and chromography. And so we can actually measure when that nutrient gets into the body, how fast it got into the body, and what levels it's in the body. And it outdid any other technology out there. It sounds so simple, but it is absolutely brilliant. And the one study that I really like, and it was entitled phytochemical conjugation. Well, it's just a big term that you're taking nutrients from plants and you're conjugating them, you're attaching these glucose molecules, and they're like enveloping the nutrients to, when you place it on the tongue, bam, it goes right into the vascular system, and glucose can cross the blood-brain barrier. So we're getting these nutrients in to support our brain, but these 3 nutrients also support our microbiome. Now, cyclodextrin technology revolves around a very important triad. It is the triad of safety, efficacy, and bioavailability. So safety, obviously, we want to always have safety as part of any technology. And then I'm going to get into that a little bit more in detail with other research studies going on with our technology. Obviously, efficacy, is it working? Well, with all the people I've been talking to and hearing the testimonials, well, yeah, it's efficacious. It's doing in our body what we expect it to do. And is it bioavailable? Well, that goes down the lines of being able to measure these nutrients as they come into the body and how they are bioavailable to our vital organs and our cells. So when we look at something like curcumin, when you take it orally, you're going to take a pill that's about 500 milligrams to maybe up to 2 grams a day, because as soon as you take this nutrient, like a lot of nutrients, there's enzymatic breakdown in our GI tract. So we've got all these enzymes, it starts with the mouth, the amylase, and then we got hydrochloric acid and other enzymes, stomach and small intestine. So it's becoming less efficacious because you're breaking it down with these enzymes and hydrochloric acid. And then also there's first pass through the liver, which also degrades it more. So when you take curcumin in these higher doses, well, yeah, you can increase your side effect profile, which is no good, but it's a slow way to get the curcumin into the vascular system. It's very variable, and it's unpredictable because they've done studies on measuring oral curcumin and other nutrients. And sometimes these nutrients don't appear in the vascular system for up to 6 hours. So this is brilliant because we're getting it in instantaneously. So it's not slow, it's fast. It's not variable, it's consistent. And we can measure it to, again, know its bioavailability. So I love the fact that we have this triad of safety, efficacy, and bioavailability, because that's really important. With our product, okay, I just had mentioned 500 milligrams to up to 2 grams a day orally, because you need higher doses to try to get some stuff in the vascular system so it can work. When we create a strip, there's only 200 micrograms, tiny amount of curcumin that, again, bam, we can measure. It's there, it's bioavailable, it's efficacious. So this study that also, looked at the curcumin, looked at coenzyme Q, looked at the active ingredient in green tea, and we're seeing the same thing, that these just tiny amounts with this cyclodextrin technology goes right into our body immediately and starts working. So with us, we've got this great triad of the thiamine, vitamin B1, and acetylcysteine, which is now key to create glutathione in our body, the most powerful antioxidant that we can produce. And we have the curcumin. And research on curcumin goes back centuries, and it's been used for centuries because the most current research really shows promise that this is a nutrient that has promise. So we're not making claims. I'm not saying we're curing anything. Shows promise in the areas of being an anti-neoplastic and anti-inflammatory. We know it's a powerful antioxidant. And we also know that this triad of nutrients within our axis clarity supports your microbiome. Now, let me touch upon some other studies that are going on out there with our technology. And this is unique to this company. Nobody has this yet. However, the pharmaceutical industry is heavy in terms of doing research with this delivery system. Now, the pharmaceutical industry is not my favorite industry. However, the fact that they're looking at this technology and studying it just means that they actually are looking to deliver smaller amounts of a drug that will still be efficacious, but to lower the side effect potential and interactions, adverse interactions from drugs, because it's a lower amount of the drug that will be efficacious and bioavailable, but not these huge doses that cause a lot of toxicity. So one of the studies looked at something called doxorubicin. This is a chemotherapeutic agent, and this is given in various cancers. And doxorubicin, you can't even get it in an oral form because it would be massive doses because of what I just mentioned. So they can inject it, and you can actually use our technology through injection mode, which is what the pharmaceutical industry looked at with doxorubicin. So doxorubicin, because even given IV, you still have to give a lot of it for it to help with cancer. And it does help with a lot of cancers, but the side effect profile is absolutely crazy. People, nausea, vomiting, losing their hair, fatigue, sick all the time, just don't have any energy. So doxorubicin is kind of one of those nasty ones. But they're finding that they can introduce tiny, tiny, tiny increments of the doxorubicin via IV with our cyclodextrin technology. And people are getting results with their cancer, but they're not getting side effects. So the fact that they're looking at this technology, I think it's brilliant, because if we can deliver less of a medication or less of any nutrient and prevent any side effect profile, then that is great. Because when I looked at how many of my patients had drug-drug interactions with their pharmaceuticals and they had severe side effects, I mean, there's hundreds of thousands of people every year in North America that go into the hospital with a drug-drug interaction or severe side effect that can potentially lead to early death. So we've got these great studies. We have a technology that works very fast. So you're going to hear terms like passive diffusion. Well, that just means that when you stick it on the tongue, it's going right in. Okay, it's diffusing, and it's bypassing any enzymatic degradation of the gut or any first pass hepatic metabolism. And again, like I said, the glucose molecule, it's carrying with it nutrients, and it can cross into our brain. Now, these nutrients also support our microbiome of the gut. And I consider myself, excuse me, the hoarse voice today. I've been talking to so many people. So the microbiome, I consider myself to be a true expert in this realm. So let me talk to you about what is the microbiome. The microbiome are trillions of organisms that live in your gut, mainly in your large intestine. Now, it's kind of funny to think we have all these microorganisms in there, but we do. And we have good microorganisms and we've got bad microorganisms. Well, we want the good, right? Because if you're out of balance and you have more bad than good, then you're set up for an irritable intestine. And this is something I would see every single day in my practice. It's the gas, the bloat, the distension, the pain, diarrhea one day, constipation the next, or you can have dominant diarrheal or dominant constipation, irritable bowel. So when we allow the microbiome to be stimulated and supported, and these will be the good ones, then we can start to stabilize imbalance within our gut. And also with this triad of nutrients, especially with the curcumin and then creating glutathione within our body, these powerful antioxidants also help with the junctions in our gut. So if you think about our gut, there's the lining of the intestinal tract. So let's think about the large intestine, the colon. So it has a lining, and there's like little junctions within the lining. And so if you're not supporting the microbiome and you're not supporting these junctions, they can start to open, and that can be a setup for leaky gut syndrome. Leaky gut is exactly how it sounds. You've got toxins within the large intestine. If they start to leak into the vascular system, it causes toxicity within us, within our body, and it can also ignite the inflammatory cascade in our body, but it can also ignite autoimmune phenomenon and imbalance to our vital organs and to our brain. So with our nutrients, and why we call it Axis, we're stimulating to support the microbiome, and then these organisms have the ability to produce neurotransmitters like serotonin, and dopamine, but especially GABA And it will also stimulate a nerve called the vagus nerve. And this is the superhighway between the gut and our brain. They're always communicating. So if you stimulate the microbiome and you've got a glucose molecule carrying nutrients to the blood-brain area, and you are stimulating with good neurotransmitters and stimulating the vagus nerve, there's your connection, there's your axis. And boy, that's important, because especially going into the holiday season, there's a lot of stress. We're not eating as well as we should be. We may be ingesting toxins, smoking toxins, whatever. I mean, the holidays are crazy, but you want something to stabilize your gut, and you want something to help stabilize the mood and help to stabilize your brain, to help with focus, with stamina, with multitasking, to help with anxiety, to support with depression. There's so many great things that happen when we stimulate this axis. It's really, really important. The microbiome, because it does sit in our gut, is also responsible for supporting our immune system and our endocrine system. Your gut is the largest endocrine organ in your body, and about 85 to 90% of your immune system sits in your gut. So you have a healthy microbiome, you're stimulating that healthy access between the brain and the gut, but you're also supporting your endocrine system. Those are your hormones. And you're supporting your immune system, which, boy, we need it in this day and age. But you're also supporting very important vital organs that are also responsible for detoxification. So you're supporting your liver, your respiratory system, your kidneys. You're also supporting the cardiac system, the vascular system, and you're trying to ward off inflammation from grabbing hold of your body. And inflammation is the secret killer. And there's so much out there about how inflammation is directly related to different cardiac diseases and different chronic diseases. So you want to ward off inflammation because you want to ward off chronic inflammation. You want to try to ward off not just like arthritic conditions, but autoimmune conditions, inflammation of our muscles, inflammation that can sit in any area of the body. And when it becomes chronic, it can start to lead to degenerative disease. The other thing with supporting your vital organs and your detoxification pathways is that we as a society, we bring a lot of toxins into our body. That's always been my soapbox, toxins that you place on the skin, that you breathe, that you ingest. These toxins, they like fat cells, and they like to sit in fat cells. So there's a disorder of the liver called non-alcohol related steatohepatitis. It means fatty liver. And toxins and fat sit together. And if they start to clog your liver, then you're also going to see problems with a sluggish thyroid. And if the liver slows down, you're having a harder and harder time to cleanse impurities from your system. But if your liver is fueled with these good nutrients and this whole microbiome supporting basically every facet of homeostasis in our body, then when you start to cleanse impurities from your body, the fat cells don't have much value and they shrink. So people that deal with intra-abdominal obesity, that sits around the thighs, it sits around the hips and the abdomen. This is toxic soup. And it's linked to something called metabolic syndrome. And metabolic syndrome is linked to type 2 diabetes and high blood pressure and cardiac disease, high cholesterol, high triglycerides. So when you start to take this product and you're supporting your detoxification pathways and your microbiome and everything else that I mentioned, the body starts to cleanse impurities and starts to get healthy. And what's really neat about people that really have a high functioning liver, as well as other systems that are detoxifying systems, they will notice that the healthy body craves healthy things. The unhealthy body will crave unhealthy things. And if you are craving these unhealthy things, they're usually not going to allow you to create balance or quality of life. And I've talked to people that have been on programs that are, they said, I don't have that caffeine addiction anymore. I can't even smoke cigarettes. They taste horrible. I don't even think about having alcoholic beverages like I used to. I feel like exercising because I've got the energy. And remember that thiamine in our product, that B1, that's all about cellular energy. And so you feel energetic and you feel clear and you feel like, oh, I'm going to walk today. I'm going to do something to exercise. And then you're staying hydrated with water and you're losing bad cravings and you're making good choices. So what we have in our hands is a true gift. And this is a gift that's a unique technology. Just remember, it's about safety, efficacy, and bioavailability. And because of those three things, we've come up with something golden that is standalone in our industry. Now, could we see this type of technology in the future? I think we'll see it with the pharmaceutical industry because, you know, again, there's so many side effects and drug-to-drug interactions nowadays that we would like to see, you know, if you've got to be on a med, that it's a very low amount so that you don't suffer from side effects. You know, I throw socks at the TV when I see pharmaceutical commercials because the side effects are like this, it's like a page long, right? It's like every side effect. I'm like, that's just horrible. I mean, there was this one drug and I forget what it was called, but one of the side effects was compulsive gambling. I don't know if you ever saw that commercial. I'm like, okay, this drug gives you compulsive gambling issues. So I like the fact that, you know, pharmaceutical companies are looking at this technology to allow us to not be overdosed with drug side effects and drug interactions. So let me close with this. I hopefully imparted enough knowledge that you can use this tool to help educate people on what we have, the cyclodextrin technology. And, you know, dextrin, if you think about it, like cyclo, I kind of envision, okay, it's like a circle, you know, it's all these little glucose molecules. They're cycling around the nutrients, and it's water soluble, and dextrose and dextrin is a sugar. So we have, again, a water soluble cyclodextrin technology that rapidly gets into our system through passive diffusion, and glucose has the ability to cross into our brain. And you're balancing your microbiome. You're balancing the junctions of the gut to hopefully prevent leaky gut, and you're hoping to prevent a cascade of inflammatory diseases, because we're working on providing not only nutrients that have been touted as anti-inflammatories, but if we've got chronic inflammation, we need to address that as well. And in that whole scenario, you're supporting your endocrine system, your immune system, your liver, your thyroid, your respiratory system, your cardiac system, your joints, your muscles, your urinary system. It's, again, the balance that we're creating. And I love talking to so many of you on the phone because your testimonials are very, very powerful. And some of you have had some chronic inflammatory conditions, and you're seeing some really great things with our product. So it's my responsibility, and I think it's everyone's responsibility, that if you're with this company, Elamir, and you've got this triad of nutrients on a strip that rapidly delivers efficacy and bioavailability, it is for you to go out and share this with people. I feel like it's a true, like, moral and ethical responsibility, because you don't have to do what I did, you know, go to college for 4 years and med school for 4 years, year of internship, 2 years of residency, 2 years of GI fellowship, come into private practice. You don't have to do all that to change a life. And so let's say one day you just decide, it could be a stranger, a coworker, a family member, that you're going to share this with them and share your story and your testimonial and this gift. What if you changed a life? You know how good that feels? It just feels so good that you gave somebody else this gift, and they can keep passing it on to their friends and their family and their kids. So we have something really special in our hands. Hopefully I imparted the knowledge that you understand the basics. And what I'm going to do starting next week, and then every week after that, I'm going to take like curcumin, and we're going to dissect everything about curcumin. And then we'll do that with thiamine, and then we'll do that with N-acetylcysteine and glutathione, because each one of those is a call, because we can really dive in and understand what these powerful nutrients are doing for our internal body. So Van, I want to thank you. Hopefully I covered enough, and that's it. I'm going to, you know, just end it at that. And Van, I'll have you come and take over and close it out, please.